The deaths were accepted, shrugged off, 250, 350,000, so what?
More black males die each year from lung cancer than all who died in the Vietnam War.
It kills people, it kills more people than anything else.
More and more women are dying actually from lung cancer.
The mortality rate and survivalship of lung cancer is terrible.
Smoking is a disease. I call it chronic tobaccoism.
The tobacco industry is responsible for more death and disease, more premature death in this country than any other single source.
The tobacco companies since the 1920s have been targeting women.
We all know that advertising changes people's minds, otherwise the companies wouldn't engage in it.
You see a lot of advertisement done specifically to Hispanic students.
We have the facts. We know that smoking is a very important factor in the development of disease, and very significant disease, heart disease and cancer, which, you know, kills 2/3 of the people in this country and creates a considerable amount of morbidity. Costs this country over $40, $50 billion a year.
Health is not debatable. We got to do what we have to do to stop it, to stop the poisoning.
I'm Dr. Alan Blum, a family physician and the founder of a group called DOC, Doctors Ought to Care. Like most physicians, I spend a lot of time treating people who are sick, and often having to refer them for expensive tests such as this. But early on in my career, even as a medical student, I determined to spend at least as much time trying to prevent illness and trying to keep the cost of health care down. But obviously, practicing prevention is easier said than done. And therein lies a challenge upon which the very future of health care may depend. A major part of the challenge lies in understanding where people get their information from and how that may affect their behavior. Most doctors tend to rely on medical journals for their sole source of health information. But that's not what the general public are reading. They're reading other kinds of publications. Hi there, Jim, can I borrow one of these things here? Sure. Just to show you what I mean. Publications like The Sun, Bigfoot Found Alive. You've seen these publications, probably laughed at them on the supermarket checkout line. But like Jim, I've been reading them each week since 1975, which partly explains why I act this way. But I think it's very important to understand that this represents a very crucial formula for reaching people with health information. There's not just articles about psychic puppies foretelling Vanna White's future, or my favorite headline, Headless Man Found in Topless Bar. There's actually a lot of very important health information. Here's an article, How Your Eating Habits Can Trigger Discomfort. Excessive gas is nothing to worry about from a medical point of view, says an expert, Dr. William Stenson, an associate professor of medicine at Washington University in St. Louis. He says over 90% of the people in St. Louis have gas. Well, in fact, the very serious nature of health information may not be discussed, particularly the leading preventable cause of death and disease in our time, lung cancer, because the advertisements do not permit that. Apart from the ads for bus developers, prostate rejuvenators, and horoscopes, the only products advertised in these publications are also the leading cause of death and disease in our society, cigarettes. Keep in mind that it's not just the Inquirer, it's also other publications, whether they be news publications like U.S. News and World Report, which has perhaps on the front cover an article, How to Reverse Heart Disease. They're not going to tell you about the real cause of heart disease on the back cover, because that's their leading source of advertising revenue. It doesn't matter, in fact, what kind of publication we have, whether it be a news magazine, a sports publication, Latino, or fashion. There may be different cover stories, but it's the same old story on the back cover. The #1 preventable cause of death and disease in our society is not smoking, heart disease, cancer, or emphysema. It's Marlboro. The #1 preventable cause of death and disease, because it's the #1 brand that people are buying.
Me and my Winston, we got a real good thing, a real good taste.
In the past 30 years, there have been more than 50,000 research studies published on the dangers of smoking and the effects of smoking on health. But the tobacco companies know that a picture can be worth 1,000 words. That's why at the Doc Tobacco Archive, we've collected pictures documenting the way in which the tobacco companies have used images to sell their products. The first major effort to reach women occurred in the 1920s through the use of such magazines as Time, on the back covers of which would have advertisements like, "To keep a slender figure, no one could deny, reach for a lucky strike instead of a sweet." Could you see an ad for a candy bar saying, "No throat irritation, no cough"? The ad campaign continued through the 1930s. Do you inhale? Everybody's doing it. 7 out of 10 smokers inhale knowingly, the other 3 inhale unknowingly. Children were featured in tobacco advertisements in the 30s. ABCs, always buy Chesterfield. And at Christmas time, what would Christmas be without Santa telling that Luckies were easy on his throat and give a carton to your dad? Well, you'd say that's 40 years ago. That's not really what is happening today. Let's bring it up to date with Time magazine today, with a dollar bill draped across the doctor's face as we blame him for driving up the cost of medical care. What's the solution, Time magazine asks, for the high cost of medical care? Maybe it's their back cover. The Camel cigarette solution for 100 smokers. Maybe there are folks who never did so well in school and now they can score 100. Is there anything that's really changed with these people? The tobacco companies are able to keep up with the images of our society and are thus able to avoid the scrutiny from the mass media that they deserve.
Chesterfield for me, Chesterfield for me. You just say it's Chesterfield for me.
The purpose of cigarette advertising is not just to sell a particular brand. All cigarette ads are ads for smoking. Their main purpose is to buy social acceptability. How can anything that's advertised so heavily be a threat to society? Wouldn't the government ban these ads if the product was so harmful? That's how these ads really pay off. They buy our complacency. If you put a lie up everywhere, people begin to believe it, and they very seldom challenge it. To better understand the very best strategy for tackling the tobacco pandemic, we need to know who our opponents are, how they operate, and how they make a mockery out of everything that health professionals do. We need, in essence, to shift our focus away from a conventional medical vocabulary and onto a vocabulary of the consumer. Away, for instance, from nicotine and nicotine addiction. Away from emphysema, lung cancer, and heart disease. And away from the smoker, the user. Shift instead to the product, Marlboro, the promotion, Marlboro Grand Prix, and the pusher. Who are the pushers? Well, they're the American tobacco companies, better known as cancer's 7 warning signs. Number 1, Philip Morris, makers of Marlboro, Virginia Slims, and Benson and Hedges. Number 2, RJR Nabisco, makes Camel, Winston, and Salem. Brown and Williamson, makers of Cool. American brands, Lucky Strike and Carlton. Lowe's, Newport, Alive with Pleasure. Liggett, they're the price value brands. Get your lung cancer for about half the cost. U.S. Tobacco, makers of Skoal and Copenhagen spitting tobacco. It's simply impossible to escape the presence of tobacco companies since they've expanded their business to include so many other consumer products. Post cereals, Kraft macaroni and cheese, Miller beer, Oscar Mayer wieners, just a few of the food products now manufactured by Philip Morris. Ritz crackers, Wheat Thins, Oreo cookies, a handful of the products now manufactured by R.J. Reynolds' Nabisco brand. You might think that these companies are getting out of the cigarette business, but nothing could be further from the truth. In fact, over 70% of the profits of Philip Morris are still derived from the sale of cigarettes. And the leading brand, Marlboro, still accounts for more than twice the profit of all the 3,000 Kraft General Foods products combined.
Smoother, milder, tastier, old gold cigarettes.
The tobacco companies can't go it alone. They rely on allies like the media corporations, who not only accept cigarette advertisements, they even solicit them. Take this ad for Time magazine in a tobacco industry publication. Where there's smoke, there's a hot market for cigarette advertisers in Time. The Houston Chronicle is another good friend to the tobacco industry. They even put them in the window. Here in Houston, R.J. Reynolds recently introduced a new cigarette brand, Dakota, aimed at young blue-collar women with full-page ads like this one in the Houston Chronicle. We at DOC decided to run our own counter-advertisement with the slogan, Dakota, da cough, da cancer, da coffin. The Chronicle and other major daily newspapers turned it down. They wouldn't accept our money because they were afraid of losing the tobacco industry's advertising accounts, including that of their non-tobacco subsidiaries like Kraft Foods, Miller Beer, and Nabisco. The spread of more and more bad news about smoking led tobacco manufacturers to buy family-oriented food companies to camouflage their true identity and to polish their image. They've now gained social acceptability through the sponsorship of arts, sports, culture, education, and even health research, hospitals, and medical organizations. A key component of DOC's strategy is to monitor the tobacco industry like a parasitic disease. We use a map to see where they're going to be in our communities, a calendar to see when they're going to be there, often nights, weekends, and holidays when the kids are out of school. And above all, we use a camera. They don't like that.
Excuse me, sir. Can I ask you not to videotape you sampling?
Oh, why is that?
Because we don't allow it.
You don't allow it? Why not?
We can't because of our sampling rules. We can't allow them to be.
You can't allow it, but this is public property. While cigarette smoking has become less fashionable among higher-income Americans in recent years, the fact remains that the prevalence of cigarette smoking has declined on average by less than 1% per year in the United States. Tobacco companies and their allies in the advertising business have worked very hard to identify new customers. As a result, women, ethnic groups, and teenagers have become the primary targets of the tobacco industry.
One of the ways that a tobacco company will appeal to women in particular is to support some of their community activities, such as the Virginia Slims tennis tournament. What you have there is role models for young women. Smoking then is related to independence and freedom and being attractive. Tobacco is not that kind of a product. It's a kind of a product that's very poisonous and has a devastating effect on women's health.
You come a long way, baby. Well, by 85, you have come a long way in that lung cancer, at least among white females, is the #1 killer. And it will probably become the #1 killer among black females.
The tobacco industry has courted ethnic minority groups by becoming sponsors of civic organizations, music festivals, street fairs, anywhere they can get their foot in the door.
It's very clear to us that the black community in particular has been targeted to promote tobacco, cigarettes, and I doubt that you can find any business in this community that does not sell cigarettes. They will sell individual cigarettes for a dime or a nickel to people who cannot buy a whole pack. They sell cigarettes to children in our communities. We have some liberation colors, red, black, and green, that we use in our movement, we've used for years. I noticed very interestingly that Salem cigarette uses red, green, and black, which if a person doesn't really think about it, they will be subliminally suckered into that as being liberation colors. So hey, we buying freedom cigarettes, liberation cigarettes, you know. And so these are just ways that they grab you.
We brought all these traditions with us from Mexico. We didn't need cigarette companies to sponsor them. I mean, they discovered that we could spend that money on their products, and all of a sudden they decided they like Latino music, and here they are as great big philanthropists coming to sponsor us, to tell us what great culture we have, and they're going to help us promote it. Well, it doesn't need promotion. It survives by itself, but they need to advertise their products, and that's all they care about. They don't care about our culture. They never have, and they never will.
It still tastes good like a cigarette should.
Without a doubt, the most important market for the tobacco industry is children. If you've reached your 18th birthday in this country and you haven't started to smoke, you only have about 10% chance of ever doing so. Doc's research has found that even small children can recognize the cartoon logos in cigarette advertisements as quickly as they can Mickey Mouse. The tobacco companies say they don't want kids to smoke. In fact, they insist on it. They take out advertisements with slogans like, "We don't think they should smoke. It's the law." R.J. Reynolds Tobacco Company. This is the same industry that says that smoking doesn't cause lung cancer, isn't connected to heart disease or emphysema, and couldn't even cause a cough. We at DOC feel it's important to document what else they are doing. I think it's important to take a look, too, at such specimens as the Winston Cup racing cars. Not many adults collect these. Mattel Hot Wheels Marlboro racing car with extra Marlboro decals. A Virginia Slims T-shirt for your baby. Or how about these cigarettes? Marlboro Class A filter cigarettes or Marlboro Bubblegum Magic Colors cigarettes. Naturally, tobacco companies claim they don't aim their advertising at children or teenagers. They blame parents and peer pressure for teenage smoking, and they've even created a booklet to help parents emphasize that smoking is only for grown-ups. What better way to get a kid to do something than to tell him he's not old enough or mature enough to do it now? Despite their denials, the tobacco industry reaches children in nearly every activity they like to do. None is more important than sports.
No tour of Houston would be complete without a visit to the Astrodome. In this case, for the Camel, Mud, and Monster series. The tobacco companies like to say that peer pressure is what causes kids to smoke. But as you can see, peer pressure can be bought and paid for right here at the Astrodome.
Sports and cigarettes. The connection's not new. It goes back more than a century. It used to be that tobacco companies would sponsor athletes or maybe even an entire team. But today they sponsor entire events and even sports facilities like this Camel GT auto race at Laguna Seca, California. You can get all sorts of souvenirs. Your racing program, a t-shirt for the kids, and a Camel drinking cup, which has your very own Camel endotracheal tube for those we're going to have to do tracheostomies on. But the tobacco companies don't just reach youngsters out at the events themselves. They also do it through television. That's right, the main reason why tobacco companies sponsor sports events is to remain on TV, even though it's been illegal to advertise cigarette brand names since 1971. Let's take a look.
Coming up, of course, IndyCar racing, Paul Page in the Marlboro Grand Prix from the Meadowlands.
And the green flag is out. They're underway. And Michael Andretti tries his move up from the second row, but they stay aligned. That's Rick Mears, of course, number 3, the Marlboro car, lined up right behind.
What's so sad and so amazing is that this is totally illegal. Yet the U.S. Justice Department has never enforced the ban on tobacco advertising on television. Do you think it's because of the millions of dollars Republican and Democratic leaders receive from the tobacco industry? So what can be done to involve everyone in counteracting the major preventable cause of death and disease in our time? Well, in 1977, after founding DOC, I was joined by 2 family physicians, Dr. Rick Richards and Dr. Tom Houston. Our aim to tap the highest possible level of commitment of every health professional in counteracting the tobacco pandemic, and also to tap the highest level of creativity of every young person. We developed a multi-layered positive health strategy: clinic, classroom, and community. Obviously, in the clinic, we need to talk to patients about the costly ripoff cigarettes really are. But it's not just the people who smoke, it's their families as well that we can reach. Perhaps by giving a prescription that says smoking stinks to a child to give to the parent. My favorite line was the 11-year-old who said to his mother every time his father lit up, "Mommy, are you going to get married again after Daddy dies?" It needs to start small, perhaps in the waiting room, or in the school library, or even 30,000 feet in the air. The other day I was on Continental Airlines. I borrowed a couple of these to show you. But as you can predict, there's always going to be a different front cover and the same old story on the back. we take out one of our stickers, which we've developed, with a Marlboro man and a slash going through them. They say many of the ads in this publication are misleading, deceptive, and a ripoff. And we take that, we open it up, slap it right on the cover, put it right back where you found it for the next person who comes along. Outside of their clinics and medical schools, mild-mannered doc members have reached millions of school children through their Super Health 2000 program. Any physician or other health professional can adopt a class or an entire school to help young people see through cigarette advertising and turn the tables on Madison Avenue. It's important, though, to move away from traditional scare tactics and instead get young people to laugh the pushers out of town. Doc does this through ridicule of cigarette advertising images and brand names. Doc has tried to get its message out by purchasing advertising space in the mass media, not through generic Be Healthy public service ads like we're fighting for your life. The tobacco companies come along and say, we offer you more. We've tried to get up alongside ads like Country Fresh Salem. But when the billboard companies wouldn't sell us space, we bought bus benches and welcomed people to the taste of Country Fresh Arsenic. In the 1970s, a brand called Arctic Lights was introduced. So Doc's response was to invite people to discover Arctic Lungs, guaranteed to make you cool as a corpse. We've also produced posters by working with artists to tap the highest level of creativity of children. The Marlboro Cowboy is probably the most successful advertising campaign ever, one that has been responsible for millions of deaths. So Doc and artist Doug Minkler, working with school children in Berkeley, California, came up with a more honest depiction of a smoking cowboy, the Barfboro Man, a guy that throws up into his cowboy hat. The idea behind Doc's ads is to get people laughing at advertising efforts to get people to smoke. And as with all of these ideas, we need to get them out into the community. Image for image, we need to fight Madison Avenue's promotion of cigarettes. It's only when young people begin to see through these images that we will truly begin to end the tobacco pandemic. That's why Doc sponsors community and sporting events like the Emphysema Slims tennis tournament with Martina No Smokin' Over.
And I have a very important message to all girls who may be watching. You will not get to be big and famous and fine like I am by smoking cigarettes.
We do the same things as the tobacco industry, only with the opposite aim. We destroy the ad images as an integral part of community-based preventive medicine. And sometimes we simply can't let tobacco companies in our communities go unchallenged, which is why Doc makes house calls at many tobacco-sponsored sporting and cultural events. These house calls generate media coverage and serve to embarrass both the tobacco industry and the local groups who are taking their money.
Look what chewing tobacco does to you. We just appreciate it if we have plenty of room for you to demonstrate.
We're not doing anything demonstrating right now, so we're done. We did what we had to do
Great.
here.
Okay.
Do you guys take any responsibility for what you're doing, allowing these people to come in the door like that?
Sure we do. In fact, Copenhagen used to sample here in school.
Right.
They don't do that anymore.
Why not? What's wrong? Why not sample it?
Well, we've asked them not to do that.
Why
but
not?
I'm not?
Why shouldn't you allow them to
okay,
sample?
Let me stop this right now. I'm with the Rodeo Association,
Yeah.
and we just like to go outside. We'll provide a place for you to do that, and we are going to take you out here in a nice way.
Yeah,
now,
fine.
But we're not going to listen to you any longer.
Right.
All right.
Perhaps protests are a little uncomfortable for some, but they bring results. Gradually, these house calls are raising public awareness and laying the foundation to throw tobacco out of sports. Doc has been encouraging health professionals and community leaders alike around the world to move beyond pamphlets, posters, and preaching to counteract the use and promotion of tobacco. Whether it be in the clinic, classroom, or community, all health professionals, students, teachers, and businessmen and women need to be involved. What it takes is a little time, creativity, commitment, and above all, caring. How you doing? Good to see you. Yeah, I'm Doc.